Science is the great antidote to the poison of enthusiasm and superstition. Hi, I'm Juliette Selgren, and this is my podcast, The Great Antidote, named for Adam Smith, brought to you by Liberty Fund. To learn more, visit www.adamsmithworks.org. Welcome back. Since early 2020, COVID and COVID policy have dictated life across the globe. Most of the time on the podcast, I try to stay away from discussion about COVID, but this is a special occasion. Today, on April 25th, 2022, we'll be talking about the United States' response to COVID and its silencing of dissenting voices in the scientific community specifically in an urgent time of need. Dr. J. Bhattacharya is one of those voices. He is a Stanford-trained economist, PhD, and MD. He is currently a professor at Stanford Medical School and a research associate at the National Bureau of Economic Research. And he went to Stanford for undergrad, for all of you who are wondering. Lots of Stanford. Welcome. Thank you.
Oh, it's a pleasure to be here.
Before we get into it, I want to ask you this one question that I ask all my guests. What is the most important thing that people my age or in my generation should know that we don't?
I have three kids, and the oldest is 21. I think the key thing is be curious all the time. Just because even people that trust are telling you things, that I think continue to be curious even when you think your mind is made up. Be open to other voices. That's probably the most important thing to keep doing. And that's not just true for folks your age, but for everybody.
And I don't know if it's more true now that we don't look for things that disagree with what we're saying or that go against our opinions, but it seems more glaringly clear now than ever that that is important and that is a value that a society that wants to produce knowledge should have. So thank you. Let's dive in. So as I mentioned before, for 2 years, our lives have been transformed by COVID. And 2 years, that wasn't just the pandemic. That was the government's response. And that was brutal. In March 2020, on the advice of the White House Coronavirus Task Force, most of us locked ourselves in our houses for what I thought would be 2 weeks, but it turned out to be a very, very long time. I didn't go back to school until the spring of 2021, and that's longer than a lot of people, but that's also not an exception to the rule, you know? So lots of bad things. We had to wear masks for 2 years. I still had to wear masks in school until just a few weeks ago. So 2022 in the spring. And we had to get tested to travel out of the country. I had to get tested to come to school. We had to get vaccines, all of that stuff. The economy collapsed. Federal government spent $5 trillion in COVID relief. Some states had vaccine passports. There were so many things that we did as a response to this. Yet 1 million people died. There were so many mistakes that were made, but what were the top 3 biggest mistakes made by public health officials during the pandemic?
So I think the first and largest mistake is a mistake of hubris or pride. We thought, and the public health establishment thought, that by imposing draconian measures like lockdowns, that we could stop the virus from spreading, that we could protect large chunks of the population from being exposed to the disease, to the virus and the disease. And by acting to suppress the disease early, the spread of the disease early, we could stop the disease from having the impact it had. They did this without any reference to the harms imposed by the lockdowns. Hopefully we'll have some time to talk about those, but they were enormous and catastrophic, primarily for the poor, the vulnerable, and the working class. So I think that's the primary number one mistake made. It's a mistake of hubris, this idea that we can control the spread of a highly infectious respiratory virus in the populations and eliminate it using the technologies we had. We unfortunately had no technology to stop the spread of this disease. The second biggest mistake, I think, during this is ignoring probably the most important epidemiological fact about this disease. And that is that there's an enormous age gradient in the risk of the bad outcome if you get infected. Almost more than 1,000-fold difference in the risk of hospitalizations or deaths compared to for people who are older versus people who are younger. Young people, although you may not realize this because based on what you have heard, are actually very well protected against the disease just by fact of being young. The mortality rate from the infection fatality rate among the young is lower than the flu. And that includes, that's for, you can pick an age, but let's say under the age of 20, 30. And it's certainly true now with Omicron. It's certainly true now with the fact that a lot of the population is either COVID recovered or vaccinated. And so you have, by ignoring that fact, we basically ignored a key strategy, a very easy strategy we could have done, which is to protect vulnerable older people while not disrupting the lives of younger people quite so much. It's one of these things where if we had just paid attention to that, rather than trying to pretend that everyone is equally at risk, we actually would have had better outcomes. We could have devoted our attention and energy and creativity to thinking of how best to protect vulnerable elderly people and others with chronic conditions. And I think that by itself would have had an enormous benefit to older. But we thought that by suppressing the spread of the disease, we could protect older people rather than acting specifically to protect older people. For instance, by better protecting nursing homes, not sending COVID-infected patients back to nursing homes, by better changing how we provided services for older people living in the community, things like that. A lot of creativity could have gone into that, but instead we relied on suppressing disease spread. And probably the third biggest mistake is that we thought that the public health establishment and big tech and a lot of the political establishment thought that free discussion of ideas was a public health virtue. They thought that it was dangerous to allow people to contradict what the government authorities were saying is the right thing to do in order to gain compliance. That was an enormous mistake. Because I think the pandemic and our response to it would have been much better and would have produced fewer deaths and fewer collateral harms had we actually permitted a full debate to happen in the public sphere.
And we're going to get into what that looked like and the impact of that during COVID and now. But first, at the beginning of the pandemic, there were a bunch of numbers flying around. I mean, no one knew anything, but we were throwing out random numbers about the share of people who would die if they got COVID. You were always skeptical of these numbers. They were really high compared to the actual numbers. Can you explain why you were skeptical from the beginning?
Sure. So the thing about COVID is that the thing that people see and have focused on through the pandemic is this horrible respiratory disease that can produce land someone in the hospital. You get this viral pneumonia that kills you. That's probably the biggest way that people have died with COVID. The thing is, only a small fraction of people who get infected by the virus actually end up with that disease, that horrible outcome. I mean, it's real, it happens, and the death rate among the elderly is quite high, at least at least when in March 2020, it was quite high. The thing about respiratory viruses is that it's actually, because it produces this range of clinical outcomes. When I first saw the numbers about the death rates in February, 2020, my thinking went back to prior pandemics. What we learned in prior pandemics, respiratory virus pandemics, like the H1N1 flu pandemic in 2009, was that many more people were infected than showed up in the hospital or came to the attention of folks in public health. And I thought, well, this is a respiratory virus. It seems like it spreads very, very easily and rapidly. It's surely the case that there must be many people that have been infected that we just don't know about and that didn't get particularly severe illness. And so I was thinking back to those prior pandemics when I sort of had this hypothesis that maybe that's same is true here. And actually turned out to be true in COVID as well. So I ran a couple of studies in the early days of the pandemic, a few studies in the early days of the pandemic, to look for antibodies in the population in California and around the country. And what we found was that there were 30, 40, 50 times more people with evidence of having been infected and recovered in April of 2020 in California than had come to the attention of the public health authorities. And what that meant is that the death rate from for people who are, just the average death rate, if you're infected in the community, leaving aside the nursing homes, where the nursing homes, the death rate is much higher, but in the community at large was 0.2%, so 99.8% survival, as opposed to the 3 or 4% death rate that the World Health Organization was saying at the time.
And I mean, I'm not a scientist and you are, but thinking about that means that that's a ton of people who had COVID and it either looked like a cold or the flu or something that wasn't out of the ordinary. So people didn't even notice, right?
Yeah, I mean, it's the thing is that people notice what their attention is on. And in March, April 2020, the world's attention was on this new virus that was spreading around. Their attention was on pictures of people lined up in hospitals on ventilators. Their attention was on, in China, this draconian response they had to stop the spread of the disease. Their attention was on Italy, looking at older people dead from the disease lined up in coffins in cathedrals because there was not enough space even in morgues. All of the attention was on the worst outcomes rather than the typical outcome. Now, those bad outcomes really did happen. They really were terrible, and they deserved to have it. We absolutely needed to take action. But what should have happened is that we should have had a conversation informed by facts rather than informed by fear, which is the conversation we actually had. And I think that conversation would have resulted in a policy of protecting the vulnerable, older people and others who are really at high risk, not a policy of essentially harming the lives of the young in ways that harm them much worse than the virus could possibly harm them.
Before we talk about what could have and should have happened, I want to ask about what did happen, the enforcement of the rules. All of them were really broad. There were lockdowns practically everywhere, mask mandates everywhere in the United States. But there were so many exceptions that at least I thought, being at home in my room doing my podcast, I thought that it should have made people doubt the seriousness of these measures in the first place. For instance, when you're standing up in a restaurant, you can catch COVID, but once you sit down to eat, you can't. When you're in a plane, you can catch COVID. Everyone has to work remotely because you can catch it in an office, but if you sell food in liquor stores or grocery stores, you're just not as at risk. Or we don't care, ? I don't know. Shouldn't that have been a sign? And how many people, or like how much of the scientific community realized or saw that this maybe wasn't a really, I don't know if strong response is the right word, but it wasn't a uniform response. There were so many exceptions. It seems kind of like theater.
Yeah, I mean, I think a lot of the reactions of the scientific community and public health were essentially a desire to be seen to be doing something, even if that something wasn't particularly supported by actual evidence, right? So when doctors actually sometimes have this response, especially young doctors will have this, where a patient will ask them a question they don't know the answer to, and they feel like they have to answer it, even if they don't know the answer. It's actually quite bad because what it does is it demolishes trust in the authority of doctors, of public health. And that's what I think happened here, right? So for instance, you remember all those plastic screens everywhere, the plexiglass screens everywhere.
We still have them at school. It's ridiculous.
At school. I mean, there's no evidence that they solve any problem. In fact, there's some physics evidence that because they disrupt airflow, they actually might make it increase the spread of the disease. The disease is spread by aerosols. Aerosols are like clouds droplets are like rain. Mostly this disease seems to spread by aerosols. Like it sits in the air for a very long time. So the key thing in a big crowded space is how good is the ventilation? Plexiglass impedes ventilation in rooms. But we landed on it because it was a visible way to say, oh yeah, I'm trying to be safe. A lot of the public health advice, close this, close that, close schools, probably the single worst thing done during the pandemic, was made in the complete absence of evidence, in part because politicians and the public were demanding answers. The right, responsible thing to do would have been for public health to say, we don't know the answer as yet, but here are the steps we're taking to get an answer. And then conducted studies, honest studies, and worked very hard to reassure the public and reduce fear in the public, rather than what public health did, which was to say that they made a virtue out of panicking the public. The more seriously you took COVID, the better person you were, right? That was a mistake, right? That's something public health should never do. The key thing is that now, because of the ridiculous, you could point to just so many ridiculous things, arresting people who went surfing. You remember that in LA during the early days of the pandemic, the crazy masking rules and exceptions. I think because of that, the trust by the public in public health is at an all-time low, at least as far as my career is concerned. And it's really tragic because public health is quite important for the health of the public.
Yeah, I haven't been around that long, and to me, this is tragic because especially now, being able to look back and understand that it never was as much of a threat to the majority of the population as we all thought, and some people still think the damage, I can see the damage still today, and that is disappointing. But before we talk about that and all the costs and things, let's talk about the Great Barrington Declaration. Can you tell us what it is? You've touched on a lot of the concepts within it already, but why exactly did you feel the need to write such a declaration? A declaration is what a statement, It's
the first time in my life I've written one, and probably the last. So I wrote this Great Barrington Declaration in October of 2020 with two other very, very prominent, incredible scientists. There's Professor Sunetra Gupta. She's probably at Oxford University. She's probably the world's best epidemiologist, and she has a chair at Oxford University in theoretical epidemiology. And then Professor Martin Kulldorff, then of Harvard University, who is one of the very best biostatisticians in the world and epidemiologists in the world. We came together in Great Barrington, Massachusetts, in part because the three of us had arrived at this idea that we all had very grave concerns about the lockdown-focused strategy we had been following. I think we arrived there from slightly different angles, but we'd arrived at the same point. And it's actually, Julia, we touched on the themes already, right? So there's this enormous age gradient in the risk of severe disease. That's the most important thing. People who are older have a very high risk. People who are younger, much lower risk of bad outcomes. And at the same time, the harms from lockdowns were devastating. We closed schools. That will have an echo effect throughout the lives of these children, especially poor kids. You have now poor, kids who don't know how to read that are 6, 7 years old or older. We're going to have to invest in trying to make sure that deficit is made up if it's possible to do so. Kids who are 16 that dropped out of school will never come back. And this happened all around the world. Like in Uganda, 4.5 million kids, because of the school closures for 2 years, are never going to come back to school. You had health harms from the lockdowns. People skipping cancer screening. So women will show up with late stage breast cancer that should have been picked up earlier. It would have been picked up at an earlier stage and they would have survived, but now they'll die. You have patients with diabetes who will have these consequences of these diabetes that should have been prevented with good management of their blood sugar, but that skipped their appointments. People died of heart attacks at home because they were told that they shouldn't come to the hospital because it was so crowded, it was so full of COVID. We just lost sight of the fact that health is a very broad thing, not just simply the prevention of one infectious disease, but something that's much broader. We have tens of millions of people who were thrown into dire poverty worldwide, less than $2 a day of income because of the economic dislocation caused by the lockdowns. In March of 2021, the UN estimated that 230,000 children in South Asia alone had starved to death as a consequence of the lockdowns.
And just to give some local examples, so we have a friend who's a PA at one of the Virginia hospitals, and she said that cancer diagnoses were down 50% in 2021, and that's not because there's 50% less cancer. That's because people weren't coming in. So that's terrifying. I mean, 50% is a lot. And then also, one of our friends is a kindergarten teacher, and she has been dealing with the worst behavioral problems that the school has ever seen. And the kids just don't know how to act around each other. And kindergarten is a time to learn that. But usually you already come to kindergarten with some understanding of how to interact with people in a social setting. And they just have no idea. And so they're screaming, they're throwing things. They just don't know how to behave or how to treat other kids or other adults. And honestly, no one really knows how to fix that sort of problem because it's just because of this delay where there was no development because you were just with your family all the time. But how do you explain the change from how we responded to this pandemic and the way that we used to respond to pandemics? What is different and why?
I mean, I think the primary reason why we responded differently is that the essentially the ruling class, the class of people, I call them the laptop class, that actually they had jobs where they could replace it by work from home. And they made a virtue of it for everybody, even though in the US, at least 70% of the population can't replace their job by work from home. They put their interest above the interest of children and young people, and even above the interest of vulnerable elderly people. And they made a virtue of the things that they could afford to do, which is work from home. Whereas they ignored the fact that so much of the population really couldn't do that, and essentially blamed them for the continuing spread of the disease when all they were doing was living their life. In past pandemics, we didn't have the technology actually to do this. We didn't have Zoom. That actually, I mean, in some ways, if Zoom didn't exist, I don't think we would have had the lockdowns. That explains partly, at least in part, why we never did this before in past pandemics. It would have forced us to think more creatively about protecting older people without lockdowns. Actually, I want to come back to the thing you said, July, because I think it's so important. In July of 2020, 1 in 4 young adults seriously considered suicide, according to a CDC survey. 1 in 4 young adults seriously considered suicide. We basically, in order to protect the interests of a certain group of people, the laptop class, we decided that we were willing to sacrifice the lives of children, of young people, and even older poor populations, the vulnerable. That is the biggest tragedy of this pandemic, that we threw aside the lives and well-being of young people, of children, of the working class and the poor, and even the vulnerable elderly, in order to protect essentially a class of people that didn't need so much protection, the folks who could replace their jobs by working from home.
I don't know. I mean, I haven't been alive. Well, I guess I was alive in 2009, but I wasn't aware of it at that time. But this is really the first pandemic I've really lived through. I don't know if this is different from usual, but I've found that doctors were really, really risk averse, very ill-informed, and kind of tyrannical in their policy recommendations or their behavior. Is that, I don't know. I feel like that's not normal behavior. Why do you think that happened?
I mean, I think in part the perceptions of doctors are set by public health. public health made a virtue of panic, and the doctors who were at the front lines of caring for patients in the early days of the pandemic, they really were scarred by seeing patients die in front of them where they had no capacity to do anything. They were also scared for themselves because you have this new infectious disease, and now they're managing it, and they're being exposed to it. That panic, I think, led to the continuing sort of the lack of acknowledgement of these harms. Like a lot of the doctors, a lot of the public health folks were so scarred and fearful, they weren't even willing to look at what the data actually were showing. They weren't willing to look and see about the 1,000-fold difference in risk. They made a virtue out of safety, even when the actions they were taking or suggesting that people take weren't feasible or were harmful to the population. I think that a lot of it can be explained by panic and fear.
Do you think that your training in economics sets you apart in the way that you came at this pandemic and the way that you saw what was truly going on?
Yeah, I think for me, my economics training, it sort of primed me to think about collateral harms and costs. I mean, whenever we in economics analyze a policy, the very first simplest thing you have to do is you have to think about, okay, not just what are the direct effects of the policy, but what are the side effects, the unintended effects, and then compare these bad effects against the potential benefits. And for me, that's just natural. I think a lot of folks who were thinking about lockdowns in the early days viewed them as essentially costless, when in fact they probably are the single most costly, harmful public health policy that we have, at least in modern times, ever implemented.
So I just posted a podcast with Chris Coyne on manufacturing propaganda in the United States on behalf of the military. From what I've seen, it seems like the same thing happened during COVID. I read the Wall Street Journal article that after the Great Barrington Declaration came out, Francis Collins, the then director of the National Institute of Health, wrote an email to Fauci privately, which was later obtained through FOIA, Freedom of Information Act request. He denounced you and your co-authors as, quote, fringe epidemiologists, end quote, who deserve to be the subject of a, quote, media takedown, end quote. Can you tell us, with your experience with propaganda that took place during COVID, but also with the general, I don't know, what is this attitude by our leaders? Like, what is your experience with that?
I mean, what it is hubris, Juliet. The people at the top levels of our scientific bureaucracies, people like Francis Collins, who was the head of the National Institute of Health, and Tony Fauci, the head of the National Institute of Allergy and Infectious Disease, they control the funding and the minds, essentially, of countless scientists, the careers of countless scientists. They had come to think that they solely possessed the truth, and any challenge to them they thought as ipso facto illegitimate. They thought that that any opposition to their thinking about how to manage the pandemic was illegitimate. That just by fact that they knew best what to do, and that anyone that opposed them was obviously wrong. So wrong that they would justify actions that would normally be seen as outside the bounds of what a top level government bureaucrat like Tony Fauci or Francis Collins could do. And so I think they thought they were acting morally by essentially delegitimizing discussion and debate. They viewed the fact that three prominent epidemiologists at Stanford, Harvard, and Oxford were opposing their policy, writing publicly in a way to oppose their policy, was dangerous. Rather than an opportunity for discussion and justification of their policies, and maybe even modification of their policies, which they were pushing, which is lockdowns, they instead engaged big tech. They engaged media in order to delegitimize us and push us to the fringe. I started getting calls from reporters asking me why I wanted to let the virus rip, when in fact I was arguing for protecting the vulnerable, to shielding the vulnerable from the virus. It's one of these things where, like, I've spent my career in science. It's actually normal to have lots of disputes and I mean, that's what science is actually fun because of that. Like you're allowed to like disagree, and then you look at data or you develop data or experiments to see who's right and who's wrong. That's the fun of science. This was something else altogether. This was just pure demonization, smearing, in order to not have that debate, so that they didn't have to justify the lockdowns. They could continue in their path of ignoring the harms of the lockdowns, which they did and have through the entire pandemic, rather than having to face the fact that their lockdown policy did fail, and was imposing enormous harm on the population.
So, what sort of, I don't know. To me, I don't even know how to think about Fauci anymore, because so many people idolize him. I mean, he's on socks and stuff. Like, I've been to the airport and seen him on a pair of socks. And so I don't know, like, is there a disconnect between how the scientific community now sees him and other public health officials and how the public sees him, do you think?
Well, I think he's a very divisive figure, certainly in the public, but also in the scientific community now. That wasn't true before the pandemic. Before the pandemic, I admired him, actually. Like, he wrote a textbook, or he was an editor of a textbook, a very prominent one in internal medicine that I still have on my bookshelf. Same thing with Francis Collins. He was the head of the Human Genome Project at the NIH. A very illustrious career as a scientist. Had great admiration for him. But they both acted in ways that were, I'd say, is beneath both of them. And now in the scientific community, I'd say that there's still people in the scientific community who admire both of them, and actually may even approve of how they acted during the pandemic. But I think in the public at large, that's not true. I think there's I think there's an enormous amount of split in the public at large over Fauci. For scientists, I think the key question isn't, like, it's never in science. The question is it shouldn't ever be, who do I trust? The question should be, what do the data show? What's the right policy analysis? Let's have a discussion. It's not the focus is on the ideas, not the person. And so this cult of personality around Tony Fauci is actually really bad for science, and it's really bad for public health. He's a government official in control of a huge budget that funds scientists. A lot of scientists, their opinions, they rely on Tony Fauci's support in order to fund their career. A lot of, if you get an NIH grant, that actually lifts you up in the eyes of other scientists. And so you really don't have a good sense of what other scientists believe or don't believe when their self-interests are at play like they are with Tony Fauci. And I think you can get a sense of how where the temper is of most scientists by the fact that when we wrote the Great Barrington Declaration, tens of thousands of scientists signed on at risk to their own career. Some lost their jobs as a consequence of signing on. I think there never really was a consensus in favor of lockdowns. This was something that it was this idea that there was a consensus was created essentially by people like Francis Collins and Tony Fauci using illegitimate means to create this sense of consensus.
What scares me a little bit about this is that he's not an elected official. And that's not to say that we should be electing scientists necessarily to be in that role. But to have that much power at a time like this and to be able to control, which I don't think was the intent, to be able to control something like that, to be able to falsify that there is this consensus and then create entire policy agendas, spending agendas around that scares me, because looking now, that was not the right move. And it put so many people in danger, mental health, physical health even. But also, I mean, all the other costs, like the loss of school, even if that doesn't mentally set you back as a human being, it's going to damage your life path, but your education, all of it. And so, I don't know, I'm just a little afraid and or wary of what that means for the future.
I mean, I think it really does bring questions of like, how should we have these kinds of decisions be made? What role should scientists play in these decision making? Normally, we have politicians, although we love to hate them, but they serve a very important role. They mediate between opposing parties in deciding what policies to take. And if they make a mistake, there's a harm to there's a check to them, right? They can be voted out of office, they can get criticized in public, so on. When instead you have scientists in charge who control the big tech's essentially censorship apparatus or the media, so they can order devastating takedowns of opposing ideas. You have a really dangerous situation. You need to have, and it's especially dangerous because scientists do not actually have the wisdom by themselves to make these kinds of earth moving decisions, right? So scientists and epidemiologists might be able to tell you what the infection fatality rate of the disease is, but they will not be able to tell you whether it's a good idea to prevent you from visiting your grandma when she's in hospice, right? That's a very different kind of thing that depends on your values, your grandmother's values, not just simply what the risks are of the disease spreading. Scientists put themselves in a place where they really didn't belong. And that's really been the problem. That's been a big problem. And Tony Fauci in particular, because he sits on this huge pile of money controlling the minds of other scientists at the NIH, it's a conflict of interest for him to also participate actively, and he much less lead the debate, the health policy debate over what to do about COVID. He should have stayed out of it because his very participation silenced a whole large cadre of scientists with irrelevant expertise.
Does expressing this view at all make you afraid for the future of your career or of your stance in the scientific community for future things that could be as important as COVID?
So I think for me, I mean, I've been working on infectious disease epidemiology and policy for at least 20 years, and I really didn't have much choice when the disease started spreading. I mean, I basically, what was the purpose of my career? I thought if I didn't speak up, and when I realized that there was actually potential risk from doing so to my career, I had to make a choice whether I should continue to do it. And, I think for me personally, I don't know exactly if I can go back to my old role. I now have a much broader, bigger platform to talk. Questions like whether I can continue to be a scientist. I mean, I would love to dearly still be a scientist. Whether the scientific community will permit me to do that I guess remains to be seen.
I mean, I hope so, because you are the reason why this voice was heard. But also, I mean, if you keep producing data, I would hope that people don't just listen because it's you, but it's because your data shows what we should do or what factually is happening. Thank you so much for your time. I have one last question for you. What is one thing that you believed at one time in your life that you later changed your position on, and why?
Since we're talking about COVID, I can talk about my mistakes on COVID. Like probably the biggest mistake I made in terms of belief in COVID is that I thought that it was going to take much longer to get a vaccine than we actually took. And that did change my thinking. I still think it was right to argue against lockdowns before the vaccine. And I would have still argued against lockdowns if I thought the vaccine in March 2020 was going to come in 10 months. Because I think the harm of those lockdowns were absolutely devastating to so many people. But it's interesting. That's something I didn't anticipate early in the pandemic. And it changed the way I viewed what the right way to manage the pandemic once the vaccine came. In fact, I argued very strongly for using the vaccines to protect older people, primarily vaccinate older people quickly, and then lift the lockdowns once the vaccine came. So that was a change in my thinking.
Once again, I'd like to thank my guest for their time and insight, and I'd like to thank you for listening to the Great Antidote podcast. The Great Antidote is sound engineered by Rich Goyette. If you have any questions, any guests or topic recommendations, please feel free to reach out to me at thegreatantidote@gmail.com. Thank you.